Hey, it's Dr. Lenny Roberts from Summit Spine and Wellness, and I'm here today with a special guest. This is Dr. Victoria Clement. Victoria, very nice to see you.
Good to see you too, Dr. Lenny. Thank you for having me on here.
My pleasure. Appreciate you joining us. So we have some mutual patients, and I've heard nothing but amazing things and reviews from what you do and how you do it. But you're a physical therapist that's a pelvic floor specialist.
Yeah,
A lot of our patients aren't aware of what that is or how that may be beneficial for them. So do you mind sharing a little bit about yourself first and what maybe got you into that field? And then tell us a little bit more about what you do as a pelvic floor specialist.
absolutely. I'd love to share. So I actually started out my career in orthopedic PT, and then I had some underlying issues for years on years that couldn't be resolved with medicine or scans. Like they couldn't find anything on the scan. And one day I ended up in the emergency room, same kind of deal, like ovaries were fine, lower abdomen was fine. And I was talking to my friend that's a PT that because I was so frustrated. And she's like, why don't you see a pelvic floor specialist? And I'm like, okay, like I don't have anything to lose. So I went to the pelvic floor PT and she helped me clear up 85% of the issues I was having, which were incontinence, pelvic pain, and just like hip and back issues. So what I did was I fell in love with it. I thought it was magic and I started offering it at the company I was working for. But I wanted to expand my offerings and be able to do more for my patients. So I left that company, branched out, and started doing mobile therapy in the Manayunk and Conshohocken area. And then in mobile therapy, I should probably tell you what that is. So that would be me bringing my table to your home and doing the therapy there. And then around October, I met a gym owner in the area. They had some space, so I was able to kind of find a home in Manayunk. And then I still provide the services for new moms in the area. But to tell you a little bit more about my work, so if anyone is suffering with incontinence, whether that's urinary or fecal incontinence, urinary urgency, constipation, pelvic pain that kind of starts in the butt area and goes down to the knee, that's actually a nerve called the pudendal nerve, which lives in that pelvic floor and can get irritated if the pelvic floor is tight. Mm-hmm. So those are the main diagnoses I see. And then along with that is painful intercourse, like a subcategory of the pain, pelvic pain, that can actually be treated with physical therapy, and people don't know that either. But what I really love to do is help new moms that are struggling during their pregnancy, postpartum, and then those who want to kind of prevent the birth injuries from happening. So I actually got trained as a doula as well to better understand like what the birthing process looks like, understand pregnancy a little bit better, and be able to provide the knowledge that empowers the patient and gives them more confidence going into that kind of experience. So the doula education, along with preparing the body for birth. So it can be a marathon. Some people are in labor for hours to 24 hours, so over a day. So I like to make sure the certain areas of the body, like the core, the outer hips, they're strong. They're that you can withstand the physical demands of birth, and then also that the pelvic floor is lengthened. So people think, oh, it needs to be strong. It's the thing pushing out the baby, and that's actually wrong. So it's actually the uterus pushing out the baby. The pelvic floor needs to lengthen and kind of lengthen and recoil back to its normal state, which is another common misconception. But that's what I love to focus on. I treat everyone. So men can have pelvic floor issues too. The most common way that manifests that I've seen is hip tightness and pain that doesn't go away and then kind of snowballs into genital issues. So penile pain, testicular pain, Even those kinds, like the penis and testicles kind of like absorbing up into the body, which really scares a lot of men.
Sure.
Unfortunately, they go through the gamut of providers like the urologist, the oncologist, the A, B, and C person before they can get to the right person that can help. And honestly, has a lot to do with pelvic floor tightness and hip and back instability is what really is the root cause of those things most of the time.
Awesome. Just to clarify, if you don't mind, so everybody's,
yeah.
What is the pelvic floor? Can you just give us that?
Yes. I wish I had a model. I'm like looking around. I don't have my model.
Okay.
But so if you can imagine your pelvis right here. Inside the pelvis is a bowl of muscles that sit down here. They hold your organs. They're involved in sexual function, bowel and bladder function. It basically looks like a sling of muscles.
Got it. And then if you don't mind also sharing what a doula does. I'm familiar with the pelvic floor and familiar with doula, but just want to make sure everybody is as well.
Sure. Yep. So a doula is basically your support person. They know what procedures can be done during birth. So kind of educating you on what can happen, when it's appropriate for it to happen, and when you have a choice. So just providing like that advocacy in the delivery room when you're in labor and in pain and can't speak for yourself. And then they also are very good at helping you figure out positions to reduce pain during labor. So whether that's hands and knees, having your legs and hips rotated a certain way, you can help the baby come through the canal easier by using those positions and gravity as your friend. So they help kind of facilitate that, applying pressure to the hips to prevent pain during the contractions. What else was I going to say? One more thing about them. And then there's some doulas, I don't do this, but there are some doulas that can go to your house afterward. They're more postpartum doulas that are just like a helping hand. Like if you need help with cooking or laundry or taking care of the baby or assistance with like breastfeeding, that kind of stuff, they can support that as well.
Awesome. Appreciate you sharing. So this is really helpful to know. We have several patients that again have been working with you and rave about you, and a lot that don't have any idea that you're around or what you do and how it may be beneficial to them. So you're in Manioc. Could you just tell us how we can get a hold of you? If we have somebody that's looking to get a consultation, an evaluation, or potentially work with you, could you share your contact info?
Sure. So I'm actually on Leverington Avenue. If anyone knows where the Mill Studio is, inside there is a gym called Fire for Effect Athletics. I have an office you walk through their gym and my office is in there. People can park for free in that parking lot. That's a big thing. But the best way to get a hold of me is email, which is vclement@restorethefloorpt.com. I love to schedule consultations for free. It's a free 15-minute phone call, give you an idea, like give you a chance to tell me what your symptoms are, discuss what your goals are so we can curate your programs to your goals and what you want to get done as soon as possible.
Awesome. So just for those of you that might not be familiar with the Mills, that's at the corner of Umbria and Leverington, right where you're coming down Umbria to go onto Main Street, Manioc, make that where that light is there, you would go straight in through that light. It's a little bit of a tricky light sometimes to get through, but it's right there at the corner of Umbria and Leverington. So awesome. So we'll put your contact info in this, I'll put a link below, and definitely really appreciate your time, Dr. Victoria. Thanks for sharing what you do, and pleasure getting to know you more, and look forward to working together with you more as well.
Thank you so much, Dr. Lenny, for doing this. Look forward to more too. Thanks.
Thanks so much. Appreciate your time.
Bye.